In the battle against HIV and AIDS in Africa, male circumcision has gained momentum in recent years. A circumcised man is up to 60% less likely to contract HIV, and circumcision also reduces the chances of passing on the virus linked to cervical cancer in women, as well as other sexually transmitted infections. The procedure is known as Voluntary Male Medical Circumcision, or VMMC. It was officially recommended in 2007 by the World Health Organization, and agencies supporting the scale-up of VMMC identified 14 African countries where an increase in uptake would be most beneficial to prevent HIV infections. But persuading men to volunteer for the procedure is difficult. That's why in April 2013, health ministries, researchers, private sector partners, implementers and donors came together in Zambia to brainstorm the problems, share and develop ideas for increasing demand and encouraging more men to choose to become circumcised.
Senior government officials present, all cooperating partners, invited guests, ladies and gentlemen, I want to welcome you sincerely to this meeting, which is being held to discuss demand creation for voluntary male medical circumcision.
The challenge ahead is to scale up effective combination prevention interventions with adequate uptake of voluntary medical male circumcision services, quickly enough to have a transformative impact on the epidemic. The expertise and experience in this room will be invaluable over the next 3 days in sharing best practices, generating innovative ideas, and strengthening demand creation interventions for programs across the region.
Clinical studies have shown us that male circumcision could be one of the most powerful HIV prevention tools. However, the statistics alone are not sufficient to convince any individual adult man to get circumcised.
We're talking about a healthy man who's being asked to have a personal surgery, being told that after the personal surgery he's got to still use a condom.
It's against tradition, there's fear of pain, there's fear of adverse events.
Men we know do not like going to the clinic when they are sick, and this is even worse when they are healthy.
How do we take these clients from a state of opposition or apathy into a state of interest, and obviously after that interest, state of action?
And getting men to come forward to be circumcised, particularly older men, was a dominating theme.
And right from the onset, we're really trying to appeal to older men, but not alienating the younger ones as well.
The results are different, and therefore the messaging needs to be different for urban men versus rural men and younger men versus older men.
And personal peer-to-peer communication was shown to be one of the most effective approaches.
Everyone I've met with is engaging in sort of one form of this or another, either door-to-door, at taxi ranks, bus ranks, approaching men on the streets through mobilizers or peer educators. So that rather than going through a fixed script, they have something that can be tailored to that person and their particular issues.
And when it comes to communication, the role of women as partners, wives, and mothers was key to several group discussions.
But when we then did our qualitative survey in 2011, we realized that one of the key barriers that was coming out was partner refusal. Partners were suspicious of men wanting to go for male circumcision. They felt that they could have been promiscuous, and they were suspicious of infidelity.
But women can also exert a very positive influence.
When we get older men in the clinic and we ask them why they're there, 8 times out of 10 they say my wife. So for me, our biggest challenge is how do we make sure women know the same things that men know?
Working with women is an essential part of successful demand creation and something that implementers are stepping up.
We're also using women as community mobilizers, and they're actually more successful. We have seen that men can ask more, questions to women, also how their perceptions are about this.
Hello, this is Vincent Mwale, Member of Parliament for Chipangari constituency in Chipata.
The role of political, traditional, and religious leaders was also passionately discussed.
Hello, I am Chief Umena. I have a very, very important message for you. You need to make a choice in order to protect yourself.
When we talk about circumcision, we are actually talking about a cultural issue. And when we talk about culture, we cannot then disregard the gatekeepers to our culture. and these are the traditional leaders.
I'm the bridge between the past and the present. And that being the case, when it came to the issue of HIV and AIDS, it is something that had to be done with passion. For us to enjoy our culture, we needed to live longer. We needed to be alive. Otherwise, however beautiful our culture was, we were not going to be there to enjoy it.
You can imagine a woman telling male audiences about VMMC. So I stood firm. I said, I'm not addressing you as a woman wearing a dress. So I told them I was addressing them as their leader.
PSI in Zimbabwe developed a really great relationship with their political leaders, so much so that they were able to broker an agreement so that 40-plus members of parliament were willing and ready to not only be tested for HIV and have counselling, but the next day undergo a procedure.
It was clear that community leaders play a key role in breaking down barriers.
In South Africa, it took us a while to get our act together compared to other countries. But once actually traditional leaders were on board, and particularly after the royal decree in KwaZulu-Natal, the numbers of people being circumcised have grown tremendously.
After identifying which men they were trying to reach, team discussions moved on to what the message should be and how it should be presented. Advertising and marketing experts were on hand to bring private sector insights into the debate.
It's also key to help people get a fresh perspective on things that may have gotten old. It's been several years now that VMMC has been talked about. Maybe people have stopped seeing it a little bit, stopped hearing some of the messages. So we should think about ways to challenge ourselves to refresh it.
How are we positioning being circumcised? We want to create an aura around that identity that the men want to be a part of that group.
We've actually rebranded circumcision away from the clinical term circumcision to using the word love cut.
The key is to go beyond that sort of rational and factual approach, what we might call in the brand world functional attributes, what something does, how something works, to what are more emotional attributes, why something is important, what it means, and what it promises.
The crucial message was that to attract men, circumcision must be presented not as a medical procedure, but as an identity they want to be a part of.
So I think we need to ensure that whatever we do appeals to the man, ensures that it fits within his value judgments, so that at the end of the day, the action he takes is an action that will eventually not be against what he treasures as a man.
Fueled with inspiration, the participants embarked on a competition to design a new project based on the best ideas they'd heard during the 3 days.
And really the brain trust that's in this room is incredible. So just taking advantage of the behavioral economist who has one way of looking at things, and the program director that has a similar program where we can share what our challenges are.
So every single day, every clinic will be giving a phone away.
What question does this answer? The fact that, people of different, expertise have been put together, in order to think through innovative ways about demand creation, for VMMC is actually quite exciting and very interesting.
It's also good to work beyond your comfort zone, outside of your own country, and to pick up ideas and to learn new methods from researchers that are outside and beyond your borders.
By working together and drawing on expertise from different fields, the groups were able to design some innovative new approaches for demand creation.
We created a program called Lucky Man, Lucky Cut.
The exercise also enabled new partnerships to flourish between implementers and researchers, with a view to clearly evaluating the impact of their projects.
In the past 3 years, all of our results have exceeded those of all prior years combined. That's huge. This is a testament to a lot of effort and sacrifice and innovation from a very nimble, intelligent group of people, and that's you guys.
What struck me most is the determination of people to face something as difficult as this, and it's a very optimistic crowd. I think it's fantastic.
Increasing demand for male circumcision is a huge challenge, but after a rewarding 3 days, the teams left feeling full of new hope and inspiration.
we have actually converged and to begin to think about ideas that we can put together to take advantage of this funding opportunity. So we're not waiting till we get to the office on Monday. We're already doing something.